If you have flabby, sagging skin on your arms, you'll be very glad you watched this video. Usually, people with loose skin on their arms think the problem is fat and that they just need to lose weight. So, they do cardio workouts, change their diet, but none of that helps. First, I need to explain what the real issue is, and then we can find the best solution. I want to introduce you to one important term: sarcopenia, age-related loss of muscle mass. You may or may not have it, depending on your age and some other factors. Another cause is inactivity. When we stop moving a muscle or a joint, here's the real question: is it really the muscle that maintains the shape of the arm? The answer is no. What actually maintains it is something else. In our body, there is a kind of film, a special tissue that wraps around the muscles. This tissue is called the fascia. Fascia is like a bag that surrounds the arm and tightly holds everything inside it. But fascia also loses mobility, not only due to aging, but also because of inactivity. Yes, you may have fat on your arms that you need to get rid of, but fascia and muscle atrophy are actually much more serious problems. Fascia has contractile cells, so its tone can change too. So, the real question is, how do we restore fascia mobility so it can move again? Here's the problem: if you only focus on a couple of muscles, like doing triceps extensions or biceps curls, that won't affect the fascia. Those moves target only the muscles. Fascia is a much more dynamic tissue that covers many different muscle groups. That's why the solution I recommend isn't about isolated muscle contraction and relaxation. It's about functional exercises that involve at least 20 muscles working together. Fascia is one continuous, interconnected tissue. If you only focus on this small area without addressing how it's connected to your back, you won't see significant changes. If you are interested, like and subscribe to the channel, and also write your comment.